Hello there, I'm Dr. Izine, and in today's video, I'll be leading you through a series of video on primary healthcare, the foundation of primary healthcare towards implementation and planning. So this is part one of the series on primary healthcare. So today we are going to be looking at the primary healthcare, the foundation of the universal health coverage, that's UHC. So we explore the fundamentals of primary healthcare and the role it plays, the important role it plays in achieving universal health coverage. We also look at the historical evolution of primary healthcare and its core principles and its relevance as well in addressing modern healthcare challenges. Now, you should know that is a holistic approach. Primary healthcare emphasizes a community-oriented approach to healthcare. Is the grassroots level of healthcare services provided in the community and integrates prevention, treatment, and rehabilitation services. Okay, it's guided by principles which we are going to look at later. But for now, let us go into the historical evolution of primary healthcare. Now, in the very beginning, early beginnings, the idea of community-based health services emerged in the mid 20th century, where they had problems, especially when it comes to immunization and vaccination of communicable diseases. And we came up with rural health schemes in several low and middle income countries. As these are countries that had problem, accessing healthcare services. Now, as of 1978, the Alma Mater Declaration came into being, and this landmark event defined primary healthcare as an essential healthcare that is definitely needed by everyone, and emphasized health as a fundamental human right. Okay, I have a right to quality healthcare. You have a right to quality healthcare, no matter who you are. However, this faced some challenges and setbacks within the 1980s and the 1990s, such as limited funding, which is still experienced now, however, but not that much compared to that period. And there was a shift towards selective healthcare approaches. However, the primary healthcare was revitalized in the 2000s, where the MDGs, the Millennium Development Goals, brought renewed attention to strengthening health systems, recognizing primary health care's crucial important role. And this led to the Astana Declaration in 2018, okay, which reaffirmed the principle of the alma mater while updating them for contemporary challenges, emphasizing the primary healthcare's role in achieving both the universal health coverage and the sustainable development goals. Now, the primary healthcare, like I said before, is guided by principles. And what are these principles? We have equity, we have accessibility, we have community participation, we have intersectoral collaboration, and we have appropriate technology. Now, let's look at the first one, which is equity. Sorry there. Now, equity has to do with ensuring everyone has access to quality healthcare regardless of who they are, no matter their background, whether they are from a rich background or a poor background, no matter their occupation, no matter their financial status, no matter their educational status, they have equal right to quality healthcare services. Okay, that is what primary healthcare is about. The next one is the ability to access these healthcare services that is their fundamental human rights. Okay, so it involves making these services available and affordable for those in the community. Okay, it's not just saying, okay, there's primary healthcare services, but can everyone access these healthcare services? So it involves eliminating barriers such as cost, making it cheap, making it closed, eliminating distance problem, making sure that it's everywhere. Okay, you don't have to go to a far place to access these services. And of course, is the infrastructure there? So it's to make the infrastructure available and accessible as well. Then also community participation is one of the core principles of primary healthcare, and it involves communities in planning, implementing, and evaluating health programs, recognizing and understanding their local needs. Okay, what is needed in the community, what's troubling the community? You have to get services that tackle the issue, okay, not just concentrating, oh, this works in so and so's place, and so therefore it must work in. No, when you come to a community, you have to find out what their needs are, so you'll be able to provide the accurate, the right services to this population. So next one is the intersectoral collaboration. It's not just about those in the health sector, it involves coordinating efforts across multiple sectors to address the broader determinants of health. Remember, health is not it's not just the absence of diseases. Okay, it involves other aspects of health as well. We have social health, we have mental health, and other aspects of health. So it involves collaborating with people in the education sector, the housing sector, environmental sector, and of course, sanitation sector as well. And the last principle has to do with the appropriate technology, okay, using technologies and methods that are scientifically valid, cost effective, and culturally appropriate, particularly in resource control constrained settings, that's low and low income countries, okay, people that have problem accessing funding, okay, so is to make sure that it's cost effective and is appropriate in whichever community it's found. Now, what is the relevance of primary healthcare in addressing modern health challenges? What are the modern health challenges we have? Of course, we have non-communicable diseases and communicable diseases. Okay, for the non-communicable diseases, primary healthcare addresses the rise of these diseases through prevention, health education, and early detection. You know, one way of combating non-communicable diseases is by detecting them on time. And if these primary healthcare services are available to all, be able to detect these diseases on time so that they can be treated on time and reduce the risk of death. Now, next one, communicable diseases, it plays an important role in disease prevention as well as control through vaccination programs, which are essential. You know, to me, I think prevention is definitely better than cure, like they say. And also vector control initiative, for example, when it comes to Lassa fever, if you control rats, of course, it will reduce the number of people that come down with Lassa fever. Or when it comes to malaria, it reduce mosquito, providing mosquito nets and providing ways of killing mosquitoes and controlling their multiplication in the community, thereby reducing the malaria endemic. Okay, then we also have health education campaigns as well in the communities. Now, when it comes to maternal and child health, you know, when it comes to population, children and pregnant mothers are at risk of falling ill. Okay, so providing healthcare services such as the antenatal care, skilled birth attendants, which is very, very essential in reducing maternal and neonatal mortality. Also have immunization of newborn babies, children, under 5 children, even the pregnant mothers themselves. It's very, very, very important to improving health outcomes for both the mothers and the children. Of course, health inequities and prioritizes primary healthcare prioritizes marginalized and undeserved population. Why? Because they cannot easily access healthcare services like the rich population, if you get what I mean. So it makes sure that this healthcare is both equitable and also inclusive of this population. So, how is the primary healthcare and universal health coverage linked? Of course, primary healthcare, the grassroots, and of course, they share a common goal of ensuring equitable access to quality health services. Universal health coverage cannot really work without having the primary healthcare aspect there, because the primary healthcare shares the same goal as universal health coverage, and it provides the foundation for universal health coverage by addressing the majority of the health needs at the community level. So once health needs are properly addressed at the community level, it extends nationally and then globally, okay, and make sure that everyone is healthy. So there's equity, comprehensive care, community participation, there's financial protection, and resilient health system. However, there are challenges in linking the primary healthcare and achieving universal health coverage. Of course, number one on the list is always money, okay. There is lack of money, inadequate funding of primary healthcare services, primary healthcare infrastructure and workforce is highly crucial. Is crucial in achieving universal health coverage. There's workforce shortages, especially in our country, Nigeria, where we have the health workforce leaving the country. We have the doctors and nurses leaving the country, and if they are not there to help in achieving universal health coverage, then what are we doing? Where are we going? We are going backward, or are we going forward? Okay, so training and retaining all qualified healthcare workers are very important, especially in rural areas where they are needed. Then we have political barriers. Strong political commitment is needed, okay, to achieve health equity and access, which is necessary to overcome these obstacles of implementing primary health in our country. Now, we have success stories from different countries who you have used this primary healthcare to achieve universal health coverage. It is possible, even though it has not been achieved in my dear country, Nigeria. It is possible. Look at Thailand. Thailand invested heavily in primary healthcare infrastructure, training community health volunteers, and establishing health centers nationwide. Throughout their country, they have primary healthcare infrastructure and have been able to provide primary healthcare services at the community level. Then we have Rwanda, which is a country in in Africa, okay, and they have been successful in implementing a community-based health insurance scheme. Wow, I really love that. In our country, Nigeria, okay, we have the National Health Insurance Scheme, which is at the federal level, made for federal workers. Then in some states, they have the state in health insurance scheme. What do we have at the community level? That's what I always ask, okay, do we have that? So Rwanda has been successful in implementing this community-based health insurance scheme and deployed community health workers extensively. Then we have Cuba. Cuba was able to establish a network of family doctors and nurses, and in Nigeria we have our doctors living and nurses living. So, but Cuba had a network of family doctors and nurses at the neighborhood level. So if the neighborhood is healthy, therefore the nation will also end up being healthy. And they offered preventive and curative services as well. Then lastly, we have the Brazil. Brazil introduced the family health strategy, deploying multidisciplinary teams, that collaboration, and to develop primary healthcare services into families. So at the family level, each family has made sure that they are healthy. So what are the key takeaways from today's video? We know that primary healthcare is a very important strategy for addressing modern health challenges and achieving universal health coverage, of course, and is focused on prevention, equity, and community engagement, which makes it adaptable and an effective approach to improving health outcomes, not just at the community level, but globally. So what are the next steps? Number one, we have to invest in primary health care infrastructure to make this available to those in the community. We have to train healthcare workers and to be able to retain them. We have to also foster political commitment to health equity, which is very essential to making universal health coverage a reality, especially in our dear country, Nigeria, and improving health outcomes globally. So that's all for today's video. Go ahead to watch the next one. I think there are about 6 to 8 video on this primary healthcare video series. Okay, go ahead to share, like, and subscribe to my channel. And there's a book coming up for this, so where all this is explained in detail, and of course I've made it very affordable for students who want to get it. Bye.